Good morning, students. Today we are going to deal with the same unit, and today's topic is atopic dermatitis. I have already told you what is actually the meaning of dermatitis. Derma means skin and itis means inflammation. That means inflammation of the skin. Now let's see what is atopic dermatitis. Here the word atopic means tendency to develop allergic condition, and as I told, dermatitis means inflammation of the skin or swelling of the skin. Then let's see the definition. Atopic dermatitis is a condition that makes your skin cracked, swollen, red and itchy. It's common in children but can occur at any age. So as I told, what is dermatitis? Inflammation and infection. So the inflammation and infection leads to itchy, cracked skin, redness, and these are what atopic dermatitis is. Then atopic dermatitis is long lasting, that is chronic, and tends to flare periodically. It can happen anytime. Let's see what are the etiological factors or what are the risk factors. So in this, the first one is the inheritance. The inheritance means what you get from your parents. That can be genetic. The inheritance pattern has not been ascertained. However, in one series, 60% of adults with atopic dermatitis had children with atopic dermatitis. The prevalence in children was higher, 81%, when both parents had atopic dermatitis. When your both parents will be having atopic dermatitis, so the chances increasing. The children can have 81% of having atopic dermatitis. Now let's see the eliciting factor. Eliciting factors means our surrounding which can create the situation of getting the atopic dermatitis. In that, the contents are inhalants. Inhalants means what is present in the air and you're inhaling through your nose. So these are specific aeroallergens, especially dust, mites and pollens have been shown to cause exacerbations of atopic dermatitis. Then microbial agents, that is exotoxins of Staphylococcus aureus, may act as super antigens and stimulate activation of T cells and macrophages. So microbial agents can also cause atopic dermatitis through the activation of T cells and macrophages. Then autoallergens. Autoallergens means those who get activated by your body responses, that is due to IgE antibodies directed at human proteins. Release of autoallergen from damaged tissues triggers IgE or T cells responses, suggesting maintenance of allergic inflammation by endogenous antigens. Then foods that what we are taking every day. Subset of infants and children have flares of atopic dermatitis with eggs, milk, soybeans, fishes and meat. These are the common food products which are found to be more allergic in children. Then the next is exacerbating factors. Exacerbating factors means due to triggering responses. So these are skin barrier disruptions, then infections, seasons, clothing and emotional stress. Now let's see clinical features. Clinical features, that means what you're going to notice when you're having this disease condition. Atopic dermatitis is an itchy, chronic, fluctuating disease that is slightly more common in boys than girls, with the range of clinical features. The age of onset is between 2 and 6 months in the majority of cases, but it may start at any age, even before the age of 2 months in some cases. The distribution of the eruption varies with age. So mainly this is divided stage wise, that is infants, children and adults. So let's see what you're going to see in the infants. So in infantile phase, you're going to see most frequently start on the face but may occur anywhere, often the napkin area spared. Then the lesion consists of erythema and discrete or confluent edematous papules. The papules are intensely itchy and may become exudative and crusted as a result of rubbing. Secondary infection and lymphadenopathy are common. So these are what you're going to see in the infant stage. That is, it starts from the face and mainly in the napkin area you're going to see this rashes. Then come to the children. In childhood phase, the lesions are papular, then lignified, plaques, erosions, crusty, especially on the antecubital and popliteal. The neck, atopic dirty neck and face may be generalized. So this is what you're going to see in childhood phase. Now let's come to the adult phase. They are similar distribution, mostly flexual, but also face and neck with lignification and excoriations being the most conspicuous symptoms may be generalized. So same you are going to see in the adult also, but as the skin area surfaces increase, so you can find it more widely. Let's see the common signs and symptoms you are going to notice. Dry skin, itchy, especially at night, red to brown gray patches, then small raised bumps, thickened, cracked, scaly skin, raw, sensitive, swollen skin for scratching. So these are the signs and symptoms. Then in management, let's see what you're going to do. Treatment goals are the heal of the skin and prevention phase. Treatment include moisturizing skin creams or ointments, topical corticosteroids, creams or ointments. As I have told you before, what are corticosteroids used for? They are used to reduce the inflammation of the skin. Then oral corticosteroids, antibiotics and antihistamines. Antihistamines are given to reduce the itching. Then antibiotics are given to reduce the bacterial infections, and as I told, corticosteroids are used for reducing the inflammation. Then other medications can be given as according to the symptoms. Then light therapy is given. It is helpful in getting vitamin D. Then skin care to help to heal the skin. Then protection from allergens. These are the treatment you are going to give to the patient with atopic dermatitis. That's all for today's class. Thank you to all of you.